of the meditation app Be Kind. Please welcome to the stage Dr. João Perestrelo.
Hello? Okay, it's working. So it feels like a talent show, but I can't sing, I promise, or dance. So, my name is João Perestrelo. First of all, I want to thank to the organization for the invitation of being here. It is a great honor. And I am here today to talk to you about mindfulness and mental health. So, I'm a psychiatrist and a psychotherapist. I am trained as a mindfulness-based stress reduction teacher by the University of Massachusetts, and I also work nowadays in the trauma field as an EMDR, brain spotting, somatic experience therapist, so all therapies that work in trauma. My view of mental health is a unity between mind and body. I truly believe that we can't address one dimension without addressing the other. So that's it. I'm going to talk about to you in the next 20 minutes how mind and body are connected and how we can attune to it through the lens of mindfulness. And when I was a young med student just like you, I had a difficult time because I started to have panic attacks that lasted until my adulthood. And there were many times where I felt that I could not escape from the situation as my nervous system demanded. So I started to have agoraphobia too. And as I am speaking now, my body is being activated by these memories. The trigger for me is, of course, being on this stage, talking to you, and believing that I cannot escape. Maybe I can. I have two doors here and one in the ceiling, so I'm safe. What I'm trying to talk about is a very important thing called stress. A rather vague term that, however, any of us are familiar with. And in the recent decades, numerous researchers have dedicated themselves to the study of this phenomenon, clarifying its determinants, its causes, its consequences, and more than a process that is exclusive to the human species, it is really present in all species. And it has a value for survival. We couldn't survive without stress. But of course that in humankind, this stress reaction is a very complex one, and it acquires an expression in the multiple dimensions of the individual. And when we hear the definition of stress, and stress is a reaction to a stressor, so we realize that it is stressor dependent. And this stressor can be internal, like our thoughts, or external, like a lion in this room, hopefully not. And when we hear this, we notice that stress is different than anxiety. Because anxiety can be defined as a persistent fear or worry that persists even if there is no stressor. And it is fueled by several cognitive mechanisms that are automatic and often not consistent with the situation. So I'm sure that all of you in any time had experienced this. So right now I have my organism under stress. But this stress reaction began much before I was here, maybe yesterday or the day before, or even when I was preparing this presentation. So stress became anxiety, this long-term experience. And it is based also in my previous experience. And the fear that something could go wrong, and it actually did. So this morning we were all late, so it went wrong. At this very moment, if I attune to my body, and it is a capacity that we all have, but we are often disconnected with, I can feel my accelerated heart, I can feel my cold and sweated hands. So, what is happening inside of me right now? My nervous system, after billions of years of evolution, is evaluating this situation, and it is wondering, based on my previous experience, if it has the ability to properly solve it. If it has, it will return to baseline, but if not, it will activate a bunch of reactions that will prepare me to 4 possible scenarios. And these scenarios, and you all know them, are to flight, to fight, to freeze, or to faint. And first of all, I am prepared to flee, to run away. If I cannot, maybe I could fight the situation. If again I am not capable of that, I might freeze or faint, and these last 2 set the basis for a trauma experience, but that's another talk. And we are seeing that these reactions are fundamental to survival. Although they are automatic and modulated by our sympathetic and dorsal parasympathetic branches of our autonomic nervous system, their chronic maintenance, and that's not so unusual in our daily life, will lead to burnout and eventually, of course, the exhaustion of our internal resources. That's what burnout means. So, at this point, I can ask you, is there any way to modulate our autonomic nervous system, including the sympathetic and the ventral parasympathetic branches, this last one that drives connection, easiness, and relaxation? And maybe it is. So, before I properly talk about mindfulness, and even if I am talking about it since the beginning of this presentation, I want to ask you if you have ever heard about rumination. And rumination, it is a well-known concept in veterinary medicine. Cows are always doing it, but we humans also do it. And it is a very important concept in the mental health area. And it fuels anxiety and depression. And rumination can be seen as the focused attention on the symptoms of one's distress and on its possible causes and consequences, as opposed to its solutions. So imagine a wild animal running away from its predator. If it is successful, it will eventually return to its wildlife, and no stress scar will be left behind. But we humans have a very different mechanism. When we escape, we start later wondering, what if? And our minds are full of what ifs. I could be dead now. What if I cannot escape? Will this work? And so on. So we feel stuck in our thoughts. And that's actually what happens when we are doing nothing. Our mind is very busy wondering about everything. And actually this wandering state, it's the default state of our minds. It's normal. And there's some structures in our brain that are responsible for that, and we have this one, the default mode network. And this default mode network involves some areas like the prefrontal cortex, the anterior and posterior cingulate cortices, the precuneus, the inferior parietal cortices, and the lateral temporal cortices, and includes some processes such as mind wandering, autobiographical memory, self-reflective thoughts, envisioning the future, taking the perspective of others. So it is also a narrative network, and it can be called like that, a narrative network. And we know nowadays that abnormalities in the default mode network can be linked to symptom severity in a variety of mental disorders, indicating that this network could be used as a biomarker for diagnosis. As researchers' strengths in this area and linking some regions in the default mode network and psychological processes such as self-reflection and rumination and mind-wandering, much interest has been directed toward non-pharmacological means of altering patterns of behavior within this network. So it seems that there are more ways of reducing rumination, anxiety, depression without taking a pill. And meta-analyses have shown reductions in the default mode network activity as a primary outcome of mindfulness meditation. And Westernized forms of meditation stemming from Buddhist traditions have popularized the concept of mindfulness as a therapy. And these mindfulness methods have been beneficial in the treatment of psychological disorders like depression, anxiety, ADHD, schizophrenia, and so on. And preliminary findings really suggest that effects of meditation includes increases in emotion regulation, attention regulation, and self-awareness, but also in white and gray matters in experienced meditators. So we can ask at this point, what the hell is mindfulness? So mindfulness came from a word, is a translation from a word in the language Pali, and that word is sati. And sati means remembering. And the first formal translation of this word dates back 1924, so it's